afternoon. I'm Inez Ponce, the director at the Center for Health Policy Research at UCLA and a professor with the Fielding School of Public Health. I see firsthand the value of giving students the opportunity to interact with real-world applications of the principles they learn in the classroom. I know many of you students, our future public health leaders, have innovative ideas for addressing these use of the world. So welcome, and welcome to the world that we have here at the UCLA Center for Health Policy Research. At the center, we offer paid and volunteer opportunities for students to work with our researchers. And today we are launching an exciting program, the Health Equity Challenge. I'm so excited that we are partnering with Molina Healthcare's new foundation arm, MolinaCares, to give graduate students at UCLA an opportunity to build on their ideas, and for two of the best ideas, see them realized in the community. I look forward to the exciting innovations that our students come up with and watching all of our participants learn from this valuable experience. So a big thank you to Dr. Catherine Kiesman, my colleague, for leading this initiative. Dr. Kiesman is also the director of Health Equity at the Center for Health Policy Research. I thank you all for your interest and wish you the best of luck in this exciting competition. Now back to Catherine.
Thank you, Inez, for those welcoming comments and introduction to this exciting day here at the Center for Health Policy Research. If just a bit of technical issue, if I shut my camera, it's because I have an internet connection that's unstable. So I apologize in advance. I would like to add my welcome to all of the students who are attending today. We're so glad that you're here and that you're interested in this opportunity. This is such an important opportunity for the Center for Health Policy Research to support students who are our next generation of leaders and problem solvers who are positioned to address health inequities in our society. In the course of the next hour, we're going to share some general information about the Health Equity Challenge sponsors, the program's purpose and goals, and more detailed information, which I think you'll be keen to learn about, the application process, the review criteria, and the components of the program. As we go through this session, when questions come to mind, please feel free to post them in the Q&A or in the chat. We're saving plenty of time at the end of the session to hear from you and to answer any questions that you may have. Now I'm delighted to introduce to you two exceptional leaders from Molina Healthcare. Carolyn Ingram, who is the Executive Director of MolinaCares Foundation and Executive Vice President for Molina Healthcare, Inc., and Abby Totten, who is the Molina Healthcare of California Plan President. They're going to be sharing information with you about the MolinaCares Accord, their commitment to advancing health equity and sponsorship of this program. And we're so grateful for their vision and generosity that has made this all possible. So I'll turn it over, and I'm not sure if Carolyn actually was able to join us. If Carolyn is not here, it will be turning this over to Abby.
Hi, Catherine. Thank you. This is Carolyn. Hopefully you all can hear me. Maybe just give a thumbs up if you can. All right.
Great.
So thank you so much for the opportunity to join you all today, and thank you for joining the conversation. I want to talk a little bit about the MolinaCares Accord and the commitment from the charitable foundation. So Molina made a decision back when COVID was launching. We saw some of the outcomes that have really been hitting some of our most needy populations hard, that we really needed to do something in that regard. And so we started the MolinaCares Accord, which is our commitment to working back into the communities that we serve to help focus on uplifting those communities really one life at a time, and established a 501c3 quickly. We then launched it across the country, and we've launched now 18 chapters. And in 2021, we went ahead and made over 447 grants across 22 states, where we've made commitments of about 8.3 million. A lot of that is in California. And a lot of that work, because that's where Molina started and that's where our home base is around focusing on racial health disparities and what we can do to improve people's access to care in communities, because it's very important to us, but also important to the mission of the charitable foundation. So we're very excited to partner with UCLA to bring this to light. And Abby's going to talk a little bit about some of the projects in California. But before I turn to her to do that, first, just so you all know, up on your screen, you'll see the areas that the MolinaCares Accord and the foundation really focus on. And that's on, of course, racial disparities in access to care, social determinants of health. And in this first year, a lot of our funding went to social determinants of health, really, because the COVID pandemic really brought out in a lot of communities, especially in rural areas, problems with access to food security, problems with access to transportation to get to appointments. And then, you know, over time, we've also seen some changes, obviously, in terms of the economy and what that really means for people in getting jobs. And so trying to be able to support communities who really work with people to get placements, and job placement was also part of that work. Then we focus a little bit more on behavioral health. And in 2022, we're hoping to bring that focus up a little bit more, looking at what's happening to people as we're still in this pandemic, but coming out of some of the changes around opioid use disorder and substance abuse. We always focus on rural access to healthcare, and we've launched quite a few projects. And one of the larger ones that Abby's going to talk about is with Project ECHO in California. And then we also focus on healthcare for elderly and infirmed and the frail population, especially looking at caregiver support and what we can do to support caregivers who actually are living and working in the community with folks that need services. And then we've also kind of got an array of grants that look at supporting how people get health insurance around, you know, social economic disparities, and what can we do to support making sure people get access to care in those areas. So again, we're very excited today to be partnering with UCLA and the center, and really starting this one-of-a-kind challenge to help keep addressing these healthcare issues through equity in California, and especially with who we see as the future leaders in this space. And I say that with a lot of passion and heart. When I went to school, of course, I didn't go into college, into school to say, hey, you know what, I want to work in the Medicaid field, and I want to grow up someday to be a Medicaid director and run a Medicaid program for the state, which is a little bit of my background. But I did do that because I care a lot about my community, and I care a lot about what it means for people to have access to good care, because I grew up in a rural community where people didn't have that. I had an uncle who had severe disabilities and suffered a lot because he didn't have access to good care. So it's something I feel very passionate about. And one of the reasons why we've started this grant program is to be able to figure out ways that we can fund ideas and projects for the state of California, and specifically around Medicaid, to help out the Medicaid agency, but also to train up people who are interested in this field to become future leaders and to be able to give back in the future, because I know I'm going to get older and not always be around to do some of this work. So we want you all to come in and fill in those spaces behind us. And we hope by doing some of this, we get you excited about the opportunities that it is to work inside the Medicaid program and make a real difference in communities out there for people who are underserved and people who are frail and elderly, and some of the folks that need that help. So Abby, if you're on, I'm going to go ahead and turn to you to talk about specifically the California projects.
Yep, I'm here, Carolyn.
All right, I'll let you take it over.
Hey, thanks, Carolyn. So, hey, everybody. My name is Abby Totten. I'm the plan president for Molina Healthcare of California. You know, as Carolyn said, Molina was born out of a Long Beach physician's concern over the lack of access and equity in healthcare for underserved populations more than 40 years ago. And that mission, vision, and values runs deep in the company. And so we continue to evolve how we address issues of health equity and disparity over the pandemic and as we move into the future. You know, for Molina, our patient population is 88% Medicaid. That means that they are underserved populations at their core, and it's our responsibility to make sure that we do everything we can to help improve access and health for our patient population. Just a couple of other stats, you know, for Molina, well over 80% of our members are from a minority group of some kind and identify specifically is non-white. More than 30% of our population's primary language is Spanish. And so our goal is to make sure that as we're developing these programs, we're keeping in mind not only who we're working with, but who they're serving, to make sure that they're reflective of the community that we serve every day. I'm really excited because in 2021, we came up with approximately $1.6 million in initial commitments across California to advance health equity, increase access to care. What I want you to keep in mind when you look at the programs on the screen is these just aren't grants. These are grants and these are long-term partnerships to develop programs that serve people. So for example, we're really excited about our partnership with the Transitional Clinic Network Hubs. Really, this is an idea that as people are coming out of jails and prisons, they face not only the disparities they had before they entered, but they have a whole array of other issues that they need support in moving back into the community. And so these clinics are specifically trained to help individuals move back into the community, to feel supported and have the opportunities to engage and advance their lives in the ways that help them improve their healthcare outcomes. We also have a partnership with the American Heart Association to develop mental health wellness programs with community-based organizations that focus specifically on underserved communities and bringing the tellers of truth to have those candid conversations about the importance of mental health and how we on our own as individuals can own and move forward in positive ways with the right help and training. A couple of other programs I've really had some intimate experience with and have sat down with their leaders. For example, our partnership in the Inland Empire with Reach Out, they have prepared and launched an incredible program called Mamas y Bebés that specifically trains Latina women on how to address newborn infant issues. These are women who create a community together while they train together and learn how to address things like, how do you deal with issues of depression? How do you address self-care? How do you make sure that when you have questions about your newborn infant, that you have a support system to help you address those issues? All of these programs are about spreading really from the ground up these incredible opportunities for individuals to be self-empowered to improve their healthcare outcomes. Finally, one of our biggest partnerships, in addition to the Health Equity Challenge, is with the California Primary Care Association on their Leadership Equity Program. This is a statewide program that identifies federally qualified health centers and helps them develop their health equity plan. How do they, as the clinic systems that support our most underserved communities, continue to move forward in health equity and train their own people from the ground up into roles of leadership so that they have a workforce that reflects the individuals they serve? As I said, this is an initial set of commitments. It's something that we are excited to continue to grow and evolve over time as we learn more, not only from our current community partners, but from all of you, to move ourselves into the future. So really excited to be here and excited to have you all engaged.
Thank you, Abby and Carolyn, and thanks for sharing your personal and your professional commitment to this field. I think that the leadership and the vision that you bring with MolinaCares is so inspiring, and it's so critically important to the work that we need to do together. So we're really looking forward to this continued partnership with MolinaCares. Thank you so much.
Thank you.
I'd like to introduce two representatives of MolinaCares who are leading the Health Equity Challenge team on the ground. Brianna Janoski is director at ATI Advisory, a research and advisory firm focused on transforming the delivery of healthcare for beneficiaries with complex needs. And Stephen Summers is an independent consultant and the founder and former president of the nationally renowned Center for Healthcare Strategies. Together, Brianna and Stephen have a wealth of knowledge and bring many years of experience in developing and refining programs and policies that improve care for underserved populations. So we are really delighted to be collaborating with them on this project. And last but not least, our terrific team members here at the UCLA Center for Health Policy Research include AJ Scheitler, our Director of Stakeholder Relations, and Tiffany Lopes, our fabulous Director of Communication. She's making this webinar roll at the same time. So thanks, Tiffany. I believe you can find everybody's bio will be also shared in the chat if it hasn't been yet. They're also posted on the healthequitychallenge.com website. So I thought that this, a lot of different definitions of health equity, but I thought that this definition from the Centers for Disease Control and Prevention really sets up the discussion of our purpose and the goals of the Health Equity Challenge quite well. The Health Equity Challenge
Seems like we're having a little bit of a technical difficulty with
socially
Catherine's.
determined circumstances.
Sorry, Catherine. It seems like
worries.
your internet is going in and out a little bit.
Oh.
So perhaps shutting the video off for now would be good. Thank
Yes, those are the challenges I mentioned at the beginning. I didn't
Zoom.
realize. Thanks for calling it out.
you. Of course.
Okay, great. So let me just get my cursor here. So through your applications, we're seeking innovative ideas for community-based programs, policies, campaigns, or interventions that address an issue of health inequity. We're asking you to identify a health inequity to be addressed, for example, by increasing access to health and long-term care services, or enhancing quality of care, or improving healthcare outcomes, especially among historically disadvantaged populations. And we're also asking you to advance an idea to support community-based programs, policies, campaigns, or interventions that address the health equity issue you have identified. So who's eligible? And what are the timelines of the program? So first, you're eligible to apply if you are a current UCLA graduate student. The applications are due February 14th. All right, can you hear me?
Yes, we can hear you.
Okay, I lost you in my panel, sorry. Thought maybe I totally dropped out here. The applications are due February 14th. You might want to get them in a day early so you can have your Valentine's Day free, but just a personal suggestion. On March 8th, 10 students from the applications that have been submitted will be identified to develop full proposals. We'll have 10 students announced by March 8th, and then the mentoring will begin on March 28th. And I think I had the wrong slide lined up here. So that's the round one. The application process, I think you'll find it's pretty succinct. It's pretty brief. We have what amounts to a 2-page application. We'll ask you some information, basic contact information, some descriptive information about you. And then we ask fundamentally 3 questions. And these 3 questions really want to help us understand your vision for why you'd like to participate in the program. What is it that drives you and your interest in health inequities? What are your aspirations for reducing these inequities? By answering these questions, you can give us an idea of the types of innovations that you're thinking about, ideas you might have for a community partner, and even potentially a mentor that you've already identified who can help guide you through this process. We'll also ask you to upload a copy of your most recent CV or resume to the application portal. And the application is available at the healthequitychallenge.com website. So you'll probably like to know something about how your proposals will be evaluated. We put together a panel of independent reviewers, meaning that they're not affiliated with UCLA or with the Center for Health Policy Research. And the panel is comprised of state and local health policy leaders, program executives, and administrators who have a deep understanding of community and health disparities. And they're going to select the 10 applicants to compete in round 2. Again, that announcement will be made by March 8th. So, understanding how these applications will be evaluated, there are 3 fundamental concepts to keep in mind as you develop your application: clarity of purpose, potential impact, and feasibility. So these are the constructs that will guide the reviewer's assessment of your applications. So let's take a moment to look at them individually. So first, clarity. You want to be very clear about your purpose and your focus, both when you identify a specific health equity challenge and when you propose a community-based solution. Second, impact. You want to demonstrate how your idea has potential to move the needle on the health equity challenge you've identified. You want to illustrate why you think it is likely to make a positive change, and especially for historically underserved populations. Often ideas that are the most successful are innovative. They may take a novel approach to an existing problem. And I think my voice was breaking up again.
No, you're sounding good.
Okay. Perhaps approaching a particular population in a new way or trying out an intervention in a different or non-traditional setting. And the third criteria is feasibility. It's critically important that your idea is practical and something that the community-based organization has capacity to take on and implement successfully. So you need to think through what's doable given the resources allotted. You also need to think carefully about designing a program or intervention or using an approach that will appeal to your target population, something that they'll be able to participate in or be engaged with. So in round 2, the 10 students who are invited to develop full proposals will be awarded a $2,500 stipend. They will also participate in a mentor-mentee orientation the week of March 28th. We have to determine the exact date, but that is the beginning week of the spring quarter at UCLA. And the mentor program will continue over a 10-week period. And the mentors that you're paired with, whether you identify them in your application or whether we help you connect with a mentor once your project is selected, they're going to provide guidance in program design, assistance with identifying a community partner if that's needed, and in general, just proposal development, working to give you feedback on what might make your proposal and your ideas come to life and be presented in the best way possible. Those round 2 proposals will be due at the end of the 10-week mentor period on June 10th, and then the winners, the final 2 winners, will be announced in late June of 2022. So the top 2 proposals selected, the 2 graduate student winners will receive an additional $2,500 stipend. And the community partners named in the winning proposals will receive up to $50,000 grant from MolinaCares to implement that innovation. The student winners will monitor the implementation and share outcomes with MolinaCares, and also have the opportunity to publish a blog reporting their experience with the Health Equity Challenge. So back to our key dates. Our applications are already open. They can be submitted anytime between now and February 14th. Just a note for the online application, you cannot save it and go back to it. So we recommend that you actually put your answers to the questions in a separate Word document, cut and paste them when you're ready to submit the entire application. The top 10 students will be selected by March 8th, and then the 10-week mentor period follows, and with the final awards announced in late June. So that's the lineup, and we'd like to open it up now to your questions.
Thank you so much, Catherine, for that presentation. Hello, everyone. My name is Tiffany Lopes, and I'm the Director of Communications at the UCLA Center for Health Policy Research. I'll be going through some of the audience questions today. So if you do have any questions, I encourage you to either use the Q&A function in Zoom or the chat to ask them. So let's just get started with the first question. Are students planning on graduating in June eligible to participate?
Yes.
Yes. Great.
A one-word answer.
It's a great one-word answer. What is the timeline for plan implementation? Does it have to happen within the next year?
The idea is that the community-based organizations will be awarded, the support for the project at that period at the end of June. So the expectation is that the project would be implemented within a relatively short time following that award. Given that, and I think maybe others on our team can speak to the logistics of when those projects might get up and running. I don't know if Bree or Steve or others want to add to that.
Yeah, and I'll just jump in, Catherine. Thank you. We've done enough grant making with small community-based organizations and others over the years to know that a 6-month period is not enough of a period for completing a project, but we certainly would like to see projects begun, implemented, and give the students an opportunity to observe what is transpiring in the early stages of the project. I would imagine that the projects could go for a year-long period of time naturally. So that's our initial response to that question, which is a very good one.
Yeah. What is the typical time commitment for winners in tracking implementation /blog/reports?
Would be a period following the award. And it's really going to have to follow the same trajectory of the program being implemented. So it may vary, it sort of relates to the answer to the previous question, I think. It's likely to vary depending on how quickly community-based organization can adopt and start the intervention or the innovation. So there would be a commitment expected from the student to follow that implementation and stay in touch with how it's progressing. I would hope that you'd want to do that since it's your idea. And then the opportunity to really showcase how, an idea that you came up with is playing out in real life, I think is a very exciting and unusual opportunity actually to get at this stage of your graduate school careers. So I don't know if others have anything to add to that.
In the application process, can we have multiple ideas or is it one idea per application?
Great question. We would like to hear one idea per application. One idea that is clear and focused. Now, that said, it doesn't mean that you can't elaborate on the complexity of that. But I think it's to your advantage to have a very clear idea of what your innovation would look like. And maybe others can jump in on that because
I would also jump in. If you do have more than one idea, I think we welcome individuals to submit more than one application. So it would just be to separate out your application if you have more than one idea.
Thank you for clarifying. What types of specific or preferred measurements or analysis is Molina looking for when it comes to showcasing the impact of the intervention?
I can jump in and then I don't get Carolyn, you're off mute. Do you want to start?
Yeah, I'll start. So there's a couple of different areas that we focus on in terms of looking at all of our grants nationally that we bring back up to our board. One of the areas is around the number of lives impacted and the number of individuals served or impacted in some way. Another area is trying to focus really on what is depending on what the intervention is or depending on what the grant is about, what is it really doing to move the needle in the community in some way? So if somebody were to bring forward a project that might be helping the department look at, transportation or something, I'm again, just throwing out some ideas. What does that grant really do in terms of moving the needle on that and showing the outcome of that work? And Bree or Dr. Summers, do y'all want to add anything else that's probably helpful? I know you guys have worked on these more often.
I'll just jump in and just say that we all recognize how difficult it is to get data on racial and ethnic disparities and actually identifiers on race and ethnicity within various programs. So we know that that's a hill to climb or a problem to address, but we're definitely interested in seeing reductions in the disparities among those populations that we're most interested in.
Someone asked if it would be possible to apply as a group of students rather than an individual.
Design the program. The mentoring is really designed to be a one-on-one mentoring experience. So we are really focusing on receiving individual applications, but I really appreciate that idea. And because at the end of the day, most interventions and projects require a team. But in this case, we really want to hear your individual level idea and to apply as an individual.
Thank you. What should we look for in mentors? What specific roles will they play in the development and implementation of the project?
Great question. I think I tried to sum up some of the high level ideas, where mentors can provide guidance. A lot of it's going to be very individually based relationship based on what information and support you need, depending on where you are with your thinking and your skill set with thinking through interventions and coming up with a proposal. So on a global sense, the mentor is really someone who can guide the process. On a more granular level, they may be able to help you identify a community organization that would be a good match for your idea. They might be able to help you with thinking through your ideas for their feasibility. If you don't have experience out at a community-based organization, you may not have the insights as to what's feasible in that environment. So I think a mentor, somebody certainly that will be able to sort of guide and provide some of the resources that you might need to develop a strong proposal. Maybe others on the team have some other thoughts about that.
Yeah, based on teaching a policy task force at another university on the other side of the country for some years, I think that one of the greatest advantages that a mentor might have is having gray hair. And by that I mean having experience and knowing people out and about in the community who could be helpful. And it's really, there are a lot of relationships that those individuals are likely to have with people who could be insightful and or connected to solutions. And so I just think that's something that ought to be looked for in a mentor, and what UCLA will consider in establishing or offering mentors.
You both. When establishing the intervention, are you interested in the applicant identifying a form of sustainability in addition to the intervention? I guess the question is this targeting more of a short-term pilot / proof of concept or long-term intervention?
I think it's a very thoughtful question. I think it ties into the criteria of feasibility, and thinking about what you're asking the organization to do, understanding what the costs are, and not just financial costs, but the reorganization of the staff, for example, taking on something different, those sorts of things. I think sustainability is a very important issue to consider when you're thinking about any program in the community. It could be a pilot that turns into a long range program. Grant, if it's successful, I think that that's going to be it's going to vary depending on where the organization is and what intervention or innovation you have in mind. Maybe others want to add to that.
Yeah, I always butcher this analogy, that one about fish. You can give people fish or you can teach them how to fish. I think we're definitely interested in teaching people how to fish so that they can continue the work and be helped perhaps in the original proposal idea with the question of sustainability, because that is definitely a question that is important, both in short-term feasibility and long-term feasibility.
Thank you. Can we have more than one mentor if chosen to advance? Both mentors work closely together on many intervention projects.
Good question. You know, again, I think we started this with the idea of a one-on-one mentorship pairing, but the reality is that I think we all can have multiple mentors in our respective positions, whether it's students or you know, researchers, program managers. So, but I think for the purpose of the program and for the pairing, there's a one-on-one mentor design, mentor-mentee design, but informally getting guidance from others, I would never suggest that you turn away from those opportunities.
We've got a couple more questions, so I'm just going to encourage attendees again. If you have any questions, please try to get them to us in the next few minutes. So the next question, to what extent do applicants have creative direction on the implementation of the project after it has been accepted in the last phase? Is it equal partnership where votes will be made, or will the community organization take on all or most of the creative control once the project is implemented?
Question, Steve, did you want to reply?
Yeah, I'm going to jump in. I'm impressed by the ambition here of the person posing the question. I think the reality is that the community-based organization needs to take much of the responsibility going forward, particularly if they're worried about sustainability, because again, the student isn't going to be with that organization into the future. Now, in the proposal that gets developed, if it's clear that the students provided a great deal of energy and creativity that the community-based organization welcomes, that would be terrific. But at the end of the day, the community-based organization is going to have to assume responsibility.
Do we have a clear sense of what community partners, for example, names of organizations, would be for the proposed ideas?
Let me understand. Can you repeat that, or maybe I feel like I'm missing something? Like what the names of the community-based organizations are?
Yes. Should we have a clear sense of what the names of the organizations? Should they, if they have an idea, do they have to have a specific community organization in mind, or is that something that someone can work with them on identifying one?
Yes, to both. They can certainly propose a very specific community-based organization if they already have a good match in mind, or they can talk about a type of community organization at this phase of the application process. And then if awarded for round one, they can work with a mentor and with us to provide, you know, we will provide resources for community-based organizations that might make good partners.
It looks like those are all the questions. Oh, nope. Another question just came in. Perfect timing. Based on varying degrees of experience among graduate students working with grassroots movements to more corporate level, has there been any discussion around evaluating applications with this in mind? More specifically, does the application offer a template for submission of the proposal that is universally used among all applicants? My concern is that despite having an innovative idea and being devoted to community wellness, my application may be looked at differently to that of someone who has more experience with this process. It's a great question.
So the application is the same, to answer that part of the question, And the application template is the same for everyone. I don't know how, we have a panel to review the applications that come from different places, and we'll have a different lens to each of the applications. So I think the process is set up to be as fair as possible, across applications. I don't think that we're expecting that all applicants are going to come with the same level of experience or background. And really it's the idea and the focus and the feasibility, again, of the ideas that are presented those are the ways that the applications will be rated. So I don't think the background or experience of the applicant is going to put them into a better or worse position to be competitive.
Yeah, I would just add, I think that's a great response. I would just add that there won't be a bias in the review process against those who haven't the same level of experience as others. The purpose of this is to expose graduate students with varying levels of experience to the realities out there in the community and in health policy and in other areas of the policy world. So I think the intent is to welcome both characteristics in the pool of those selected.
Thank you. For the open response questions on the application, what would be ideal length? Obviously, we should maximize concision, but what is the right level of depth?
Thank you for raising that question. If you go to the online application, there's a question icon next to each of the questions that you should hover your cursor over, which gives you a recommendation about the length, the word length for answers to the 3 questions. So we've tried to provide a bit of a guideline for, how much content we recommend is devoted to each, and that reflects the focus on the 3 different criteria evaluation areas.
And then someone's asking if the recording is going to be emailed out. And the answer is yes, we are recording this event right now. We will be posting it to YouTube as well as to our website, and we can email the link to the recording to everybody who has registered for the event. If you have not registered for the event and you were able to kind of sneak in, if you want to just send a message to the hosts and panelists in the chat with your email address, we'll make sure that you get a copy of the recording, but otherwise you can just look for it probably tomorrow on our website, which is at healthequitychallenge.com. And I think that those are all the questions that we have. Oh, no, one more. You guys are just sneaking them in. Of the 2 pages, approximately what share would you expect to be sharing details about the health inequity versus sharing details of the proposal?
The recommended word length for each of the responses is in that portal. And so I think that should help guide your choice. I think that as long as you're speaking to both of those, that's important that you have both of those components in there. But I think that you'll see when you go to the application that will help you judge how much space you should devote to those 2 different requirements for the application.
Thank you, Catherine.
Mm-hmm.
And it looks like we have no more open questions. Is there anything that anybody else wants to share before we close out? And if not, Catherine, feel free to go ahead and close us out, and I'll let you know if any last minute questions pop up.
So Tiffany, this is Abby. I just want to really emphasize the importance of thinking outside of the box and being creative. I mean, all of the students who are on the phone here, you have incredible minds. There's reasons that you're here. And this is an opportunity for you to tell all of us all the things that, you think that we should have been doing a long time ago to address health equity. And so this is really your opportunity to bring to the table things that no one else has thought of, because we don't know everything. I've worked in Medicaid my entire career. It's my love, it's my passion, it's my joy. And I will tell you from working with our teams and working with patients in the community, there are a lot of problems that we need your help solving. And so I'm not on the panel, but I can't wait to see what this group of students comes up with, because there's so much out there that we can work together on to help improve. So don't let the slides that we presented at the beginning color what you submit. Really think outside of the box and bring us your best.
Thank you, Abby. A couple questions came in. So one, is there an interview portion to this?
No, there's no interview portion to the application process.
And then one quick clarification. We are only responding to the questions in the web portal as the proposal, correct? In the application, I don't see a place to upload a 2-page proposal.
That's correct. It's in the actual template on the website. Just to cut, like I said earlier, cut and paste into it is the recommendation. So you'll know you have your about 2 pages drafted in a Word document or whatever, whichever type of document you use, and then cut and paste into those text boxes.
Then, as I mentioned in the chat a little bit earlier, if you do have some trouble submitting the application and you get an error message, just hang on about 30 seconds or so and try resubmitting it. If at that point you are not able to get through, you can email the address that I sent over a little bit earlier, which is chprweb@ucla.edu. And then Catherine's email address is also up on the screen right now, so you can email her with any questions related to the challenge. Catherine, do you want to close us out?
Gonna bring us home.
Yeah.
Well, I just want to again thank Abby and Carolyn, Stephen, Brianna, AJ, and Tiffany for this lovely session, and Inez, who unfortunately had to go to another meeting. But most importantly, I really appreciate all of the students who've logged on today. We're so excited to hear about your interest. Your questions have been phenomenal. And so I know we're going to be receiving really incredible applications. So we're really looking forward to my heart swelling on Valentine's Day or before.
All right, everyone. Thank you so much again for attending, and we'll make sure to get this recording up on the website and adding some new frequently asked questions. So feel free to keep checking in on that, because we'll be adding more as we get them. Thanks again. Have a good day.